everybody, this is Stephanie again, certified surgical technologist, giving you another critique on a sterile setup for a surgery. The case that I am doing now is a general surgery, laparotomy, and I'm just going to show you some setup techniques that I do in my field. So as you see here, the first thing I want to point out is that I have my gowns and sheets in the bucket with the draping of the patient on my Mayo stand, so the surgeon or the residents or whoever is draping can just grab from my Mayo when and if I trust them to do so of knowing how to drape. And I do this technique to separate what goes on the patient and what is extra. I keep my gowns in here because it's better for security, and it's not dropping anywhere, because when you do put them on your Mayo stand, they always tend to slide off. I set up my bovie, my bipolar. Well, in this case, they don't need a bipolar. A staple gun, 2 suctions, a pocket so they can put the instruments in, like the bovie, and my ChloraPrep. This is my basic lap set setup. I keep all my, it goes from small to large, as you see, all my clamps in the front, all my grasping clamps, soft grasp, Babcocks, they're all in order. This is how I prefer. And if you notice, I have long needle holders here and long sponge, my sponge checks there, because if you notice, my back table is not that wide to have long instruments, and I don't like having long instruments protruding out almost to the edge, as you see those long right angles and long tonsils are. So I keep in my tray. I keep my retractors in here, as should all setting up cases should be, because this is your tray to put your retractors in. I noticed what happens is, in some cases, surgical technologists will put their retractors in the bin with water and then put their string instruments in the tray, which is frowned upon, because according to Ahorn, your bin, after you take out all the drapes and finish using them, this is supposed to be the first sign of contamination when you put the water in there. This is for cleaning your instruments. And when you have your clean instruments in a bin where you're supposed to be cleaning your instruments off of blood, it's first sign of contamination. You don't want that. You're technically still in an operating field and still sterile, but that is the first sign of blood contamination to the instruments, and it's used for cleaning your instruments. It's not used to store your instruments with water, because then what? You're cleaning your instruments with bloody water, and then you have your instruments in there with bloody water just for storage. No. Now, here I am in the corner, like I always do. I set up in a way where everything I need is right in front of me. It's not far away from me. I don't keep the instruments up front and then my my sauce behind me. I have, now for general surgery, I have 2 bowls. I keep all my softs, my Ratex, my laps. And again, with every surgery, I always put 2 sheets. Alright, so sorry about that. Had to cut for a moment. Call came in, as you heard. And again, I keep everything in front of me. I keep all my syringes together. It's basically an organized setup, as what I consider an organized setup. Everything is compact. I see everything. When somebody relieves me, everybody sees everything in one spot. It's not where I'm hiding anything. I still have my count sheets, so when my circulator comes and counts with me, I'm ready to hand it off. Now, if you notice my bag's up here, I don't like to put my bag up there. I like to put it literally in the middle of the table or far away from me, because my body rubs up against the table because of my sterile, I'm short, my sterile abdomen rubs up against the table. And if you notice, this is pretty a high top table, and I'm only like this, if you could tell, I'm only this taller than the table. That's not much. So I like to keep my bag farther away from me because, again, my abdomen rubs against the ridge and it rips off my suture bag. And again, this is how I set up. I have my saline labeled already. I don't have any medications. And if you see that. So if there's any questions, concerns, or, you know, if you like my critique, you can message me. Bye.